I bet you've noticed that there are quite a few validities in ABA. There's measurement validity, social validity, internal, external validity. Why so many, and how are they different? Let's discuss. Now, I'm going to start with measurement validity. This is one of the indicators of trustworthy measurement, and what it means is that when we look at or analyze our data, it should represent what we're actually interested in, meaning the appropriate measurable dimension was used, or that the observation period was reflective of the behavior's occurrence or non-occurrence, that the actual behavior that was measured is the behavior we're actually interested in. Because look, if our measurement doesn't reflect the thing we're trying to measure, then who needs it? Valid measurement, that's data that represents what we're actually investigating. If we don't have that, it's like not having data at all. Next up, social validity. This validity emphasizes the need for acceptability and meaningfulness to the client and relevant stakeholders. And when it comes to acceptability and meaningfulness, there are several pieces of ABA practice and/or research that are concerned. The targeted behavior, the assessment method used, the measurement procedures used, the behavior interventions used, and of course, the behavior change outcomes. All must be socially valid, meaningful, and acceptable to the clients. Internal validity. Now, this one is super important in a study. And basically, you have to prove that the intervention directly caused the behavior change and it wasn't some other unexpected variable. If we can't prove that it was the independent variable, that's the treatment, that impacted the change in the dependent variable, that's the behavior, then we don't have experimental control. And that means we can't know if the treatment is truly effective or ineffective. And then we can't make well-informed treatment decisions. So you get it, internal validity, it's important. And last but not least, external validity. This one has to do with generalization. So once you have, let's say, successful results, you know for certain that the independent variable, that's the treatment, did affect a meaningful change in the dependent variable, that's the behavior. And now you're excited because you're on to something. But now you have one more thing to prove, and that's whether or not this awesome outcome can go even further. Can it be generalized to other settings or other behaviors or other subjects? Can these results be produced in other conditions with different populations or different behaviors, different diagnoses? Like, can you imagine how excited the creators of Advil were when they found out there was external validity in their research and that Advil can be used to treat headaches, cramps, fevers, muscle aches, swelling reduction, probably more stuff too. And that this is true across most people, most ages, genders, nationalities. So you could see how cool external validity is when the outcome of a study can generalize but beyond its initial focus. Anyway, I hope you found this valid. Now try to connect each of the validities to the validity of this explanation.